Hi, welcome to ITC Tactical. I'm your host, Jonathan. In today's segment, we're going to be talking about the essentials of a tactical medics kit and how they play a role in providing the best medicine in the worst places. Stay tuned for more to come. In front of you, you'll see my original special operations equipment, micro chest rig. I run this as a medical kit, but it is meant to fit AK or M4 mags, as well as an admin pouch and a map pocket. All of the essential medical equipment that I have deemed necessary for providing life-saving interventions is in this kit. We're going to get into the nitty-gritty of the different pouches. First, we have our main admin pouch, which I run most of my medical supplies in. Some of the equipment I carry that isn't related to necessarily medical use, but just general equipment. I carry a pen light, and I also carry a folding type knife. These are what I would deem as essential to any sort of medic. You need to be able to cut clothes off people. You need to be able to cut rope in case you need it. You also need to be able to assess reactivity of pupils in case, somebody gets a head injury. I also carry a tube of oral glucose. This is in case somebody is having a diabetic emergency and they just need a little boost. So this will get them into the fight enough to get them out of that situation. Or, hey, they might have to continue the mission on with this. I also carry some other supplemental food, like some power bars, Cliff bars, things like that, for a little bit longer lasting energy. And that could be utilized by me as the medic as well, because I'm no good to anybody if I'm down. Here I have a battery-powered glow stick. It's just like the glow sticks that you would break and snap, except it uses batteries. It's a little bit more viable of an option, and I can reuse this time and time again. So there's that. And that's just for signaling or for having a little bit of emergency ambient light. Okay, here's where we get into the nitty-gritty of it. And I have got two field packs, or what I have deemed field packs, that contain everything that you might need to stop a major bleed, plug a hole in somebody's chest, and also put a hole in somebody's chest in case they have a tension pneumothorax. So I'm going to get into it, break one of these kits open, and we'll be right back. Here in front of you see an individual field kit that's been broken down to all its essential items. I'm going to go through, talk about each item and why we use it in a tactical environment. First, we've got our airway. This is a number 28 MPA. The reason we use MPAs in tactical medicine is because they are tolerated by the largest number of people. This is the preferred airway. They're also tolerated by patients that are awake and patients that are unconscious alike. So that's why we use that. Next, we're going to talk about our 14 gauge needle. This is used for needle decompression of the chest. This is for a tension pneumothorax, and to kind of quote my instructor, it's a fancy Latin term, but basically means air in the chest. So when you've got that air in the chest, that air is causing everything to shift over, putting pressure on the heart. You need to get that out of there. So this is what we utilize it for. Next, we're going to get into bleeding control. So I've got my quick clot sponge. I also run quick clot combat gauze. That's a mouthful right there. We're going to use this as hemorrhage control. We also have some dressings to go along with that, as well as some gauze to pack a wound or to wrap around and create a pressure dressing. And then we've got our gloves. You might be wondering what I use for a chest seal. Well, traditionally you're going to use a commercial product called a Halo chest seal. There's a couple other ones, a Hi-Fi, and different things like that. What my team has started to use is expired AED pads. This is a pediatric pad, and we have simply taken the electrodes and cut them off. It's sticky and it stays, and if you need to lift it up, you can lift it up. Basically, that's all you need. Something that's sticky, something that's occlusive, something that's going to stay. That's what we use. Alright, next we're going to get into the other parts of the pouch. Here are the other medical supplies that I carry outside of the field packs or field kits that I showed you just a second ago. This is the newest piece of equipment to our kits, and our OMD and team leader, who's a doctor, issued these to some of us. And this is the C-locks with the applicator and plunger. Basically, these are granules that are in a syringe. You put the plunger in the syringe and place it inside of a wound cavity, and this helps with clotting. The instance in which you're going to use this is arterial bleeding, as well as a wound that is too large, or excuse me, too small, I should say, to physically pack. So you're going to place the tip of the syringe in there, place the plunger in, depress the plunger, the granules are going to fill the wound, and then you're going to apply direct pressure. And this just helps with clotting and hemorrhage control. Here I have a CAT tourniquet. I carry 2 of these on the kit itself. And I also have a tourniquet on my body that I carry. It's a TK4. That's generally what I carry every day. Let me show you an example of that. It is just an elastic band with 2 hooks. You unfold it and use it. These are okay. If I have my choice about it, I'll take a CAT tourniquet or a soft T wide. But for everyday carry in a pocket, like a back pocket like I do mine, this is perfect. So this is a supplement to my medical kit. Also, I have a pressure dressing. You just would place this on a wound and then wrap it tight, along with 2 gauze pads. And then we talked about cutting clothes off people. These are actually trauma shears that you'd use to disrobe somebody in case you needed to get to a wound. But these are the main things that I carry in the alternate pouches. The other mission essential gear that I carry, I'll give you a glimpse at, but I'm not going to talk too much in depth about it. As I mentioned previously, I carry some supplemental food items, Cliff Bar, Power Bar respectively. It's just long-lasting, high-energy food, and I carry those because you never know when you're going to get stuck out somewhere for 4 or 5 hours at a time, not be able to get back and get a meal. So that's just something to keep energy levels up. I also carry a set of binoculars for scoping out potential hazards to me or my teammates. A multi-tool, that's pretty self-explanatory, and a rescue me tool. This is for entering vehicles. It's got a window punch as well as a seatbelt cutter. You never know when you're going to have to emergently extract somebody or emergently extract yourself from a vehicle. So I just feel that that's an essential piece of kit. Something else we're carrying zip ties. A lot of departments issue plastic cuffs. Our department does not, so these are our makeshift plastic cuffs. Anyway, I also carry a map pack. This is a county map of the area that we primarily operate inside of, and I also carry a compass in there. So this is just some extra equipment that I carry, and things that I feel will best help me accomplish any task that I am asked to perform. So, as you just saw, these are the essential items that I believe every tactical medic should carry on their person when they're operating in a tactical scenario. With what I showed you, you can treat the 3 major battlefield killers, which are critical blood loss, obstructed airway, and tension pneumothorax. I also carry a larger supplemental kit. It's a big trauma bag that has more bandages, SAM splints, more advanced airways to utilize. I also carry a soft litter in case we need to evac one of the officers or somebody that's been injured during an operation. I would also say that more than just the equipment that I showed you, what you need to seek out is training, and you need to continuously train. As an EMT, I am constantly doing continuing education hours. I just attended in November a 4-hour refresher course in regards to my tactical medicine, and in May I'm going to be taking TCCC for the 2nd time around, and I'm constantly training. You always want to give yourself the best opportunities you can in regards to knowing how to handle situations. And the more you train, the more you're going to realize how essential it is. The other thing that I mentioned, mindset. You have got to have the proper mindset. You don't ever give up in regards to somebody. But in saying that, there's a time when you need to concentrate on providing the best medicine. And sometimes the best medicine is return fire. So do what you got to do. Don't put yourself in unnecessary risk to try and save somebody, because you're the medic. Who's going to go save you if you're injured? So you got to think about these things. Anyway, this is Jonathan with ITC Tactical. Please rate, comment, and subscribe. And as the frog says, don't ever give up.